Hey there, it's Dr. Appleraju, your downtown digital general dentist. Today I want to talk about cavities. What is a cavity? Do you even know? Well, this is something we see all day long, every day. Every day we're working with our clients and our patients, we often see this. And a cavity is really an infection in your mouth, and it may not hurt. So this is something I advise my patients on an ongoing basis. Cavities are basically lesions in the hard surface of your teeth where there's bacteria, microorganisms. You cannot see them. Our mouths are full of these. It is believed that we're born without them and we vertically get them, meaning from a loved one, maybe a parent or a grandparent. Somebody tastes some food and maybe places it in our mouth, and this is where we acquire these bacteria. And once we have them, it's nearly impossible, pretty much impossible to get rid of them. So if you have a loved one who gave you their bacteria and maybe they were at very high risk for cavities, again, it's not something you talk about at dinner. However, if you noticed your mom or dad always had dental problems, cavities and fillings and root canals and all this sort of stuff, and you're also experiencing this, there's a very likelihood that may have acquired their bacteria. And now you're having to deal with these cavities. And we see this often with some of our patients who have an exceptional diet and exceptional home care, but they still get cavities. And we can certainly test for the certain strains of bacteria that cause cavities or make you much higher risk. Now, this is a complicated area and it's multifactorial. There's a lot of different reasons for getting cavities, but I just wanted you to understand that cavities are an infection in your mouth, in the hard surfaces, and quite often they don't hurt. This is one of the things that patients will often find if they haven't seen a dentist for a while or their dentist has been monitoring a cavity. Well, it's something that we're tracking, right? A cavity basically means when the lesion is so big, the tooth crumbles or falls apart. So maybe you've experienced this, and now you start getting food packed in there. Well, that just tends to feed this infection because these sugar bugs, I like to call them, or these microorganisms, they're like little Pac-Man. So you feed them sugar from your diet, whether it's in the form of liquid or carbohydrates, different types of processed foods, or maybe it's not processed foods, but processed foods tend to feed them much faster. Nonetheless, these Pac-Man are chewing away your tooth. Eventually you bite on the tooth and it crumbles, and now you have a hole and it's getting worse. And when they reach the middle of your tooth, typically where we call it the pulp, which is where the nerves, the blood vessels, and some other structures are located, this is where you get a toothache. So the throbbing, where you can't sleep, you can't function, it keeps you up at night, you have to take Advil and Tylenol, this sort of thing. That's not fun. So those teeth typically now need a root canal or extraction to save them because the infection has gotten into the middle of your tooth. And where does it go? Down through the root system and into the jawbone. And it may bother you significantly at that point, or sometimes it's very subclinical. Some patients have a bad cavity, it's gotten into the nerve, but they don't even realize it. It's not hurting them until we take an x-ray or assess them and realize, hey, there's a big problem here and this needs to be treated. Typically what I will find is it gets worse if it's not treated, either when the patient is very stressed out, when they get sick, or they don't eat well. One of those three things typically is happening when they have a significant cavity and now it becomes acute, meaning they're having significant pain. They can't function, they can't sleep, they can't work, they can't eat. It's not a fun situation. So the best way is to be assessed on a regular and ongoing basis with dental exams and regular dental hygiene therapy, the cleaning as it's commonly called. It's a little more than that, but for now, we'll just call it a cleaning. So your hygienist is assessing your mouth as well as your dentist. So it's critical you get checked on a regular basis, especially if you're not doing your part at home. We can coach you. If your diet is full of carbohydrates and processed food, that includes juices and pops, certainly we can help guide you and give you some nutrition and diet counseling. We'd love to see you. I hope this was useful for you. If you found it useful, hit the like button. If you think somebody needs to hear this, perhaps share it with them. You can certainly book online to get an appointment with us all the time, 24 hours a day. It's very easy. Just go to www.conceptdentalreddeer.ca and hit the book now button. Takes 2 minutes. Or just pick up the phone and give us a call. Our team would love to see you as a new patient. And if you're hearing this and you have a regular dentist that you love, go see them too. We want you to get the care you deserve. Keep your pearly whites as long as you can, because people are living longer. We want you to keep your teeth as long as you can. And in the meantime, stay well out there. Bye for now.